Hello and welcome to the last of 8 presentations in the 2021 Great Decisions Lecture Series. My name is Matthew Hughes and I serve as the Executive Director of the International Relations Council in Kansas City, and we're so glad to have you with us today. The International Relations Council strengthens Kansas City's global perspective by maintaining an active dialogue around world events, global issues, and their impact on our community. As a nonpartisan educational nonprofit organization, the IRC values informed civil discourse, accessibility, and substance as we work to sharpen our community's 21st century global acumen. We invite you to learn more about the International Relations Council, including other upcoming events, information on joining a Great Decisions group, and how to join the IRC as a member on our website at irckc.org. For decades, the annual Great Decisions Briefing Book has framed informed civil discussions about critical international issues. Groups around the country, including here in the Kansas City metro area, meeting coffee shops, conference rooms, and now virtually to explore these issues together and distill policy recommendations and future outlooks. To support their exploration and to bring the larger community into the discussion, the IRC is proud to offer a series of conversations with respected experts through 2021 on this year's 8 Great Decisions topics. We warmly welcome diverse perspectives and invite your engagement with these foreign policy issues from work, from home, or wherever you might be. We hope you'll engage that way with us today as we explore the role of international organizations in a global pandemic. We know that many in the audience have already discussed this topic with their local Great Decisions group, so we certainly welcome your thoughtful questions through the course of the conversation using the Q&A feature at the bottom of the screen. And whether you're joining us live today or you're viewing the recording later, please do check out and share the other conversations that the IRC has coming up as we consider a range of critical foreign policy issues in the coming months. Today, we're especially grateful to our sponsors who have made this program and the Great Decisions Lecture Series possible. In particular, thanks to sustaining series sponsor Cyprian Simkowitz and Jerry White, and supporting series sponsor Nancy C. Messer. We also deeply appreciate the support of the University of Kansas Medical Center, today's global conversation sponsor. Thank you too to everyone joining us from sister World Affairs Councils from around the country. It's now my great pleasure to introduce our moderator for today's program, who will introduce our speaker and help us to navigate this conversation. The recipient of the International Relations Council's 2019 Award for Academic Leadership, Dr. Sarah Kessler is an associate professor at the University of Kansas University of Kansas Medical Center, Division of Family Medicine Research. Her research combines interests in reproductive health and HIV to improve safer childbearing for people living with HIV. Dr. Kessler's active studies focus on developing, evaluating, and adapting mHealth interventions like the HIV infant tracking system to improve early infant diagnosis of HIV and prevent perinatal HIV transmission among pregnant women in Kenya. Dr. Kessler, it is such an honor to have you with us today and to be joined by our esteemed guest in Geneva. Thank you so much for being with us, and please take it away.
Matthew, thank you very much. It is a privilege today to introduce our honored speaker, Dr. Samira Asma. Dr. Asma is the Assistant Director General for Data Analytics and Delivery for Impact at the World Health Organization. And Dr. Asma brings more than 25 years of experience in building local country capacity and meaningful partnerships for public health programs and policies to generate substantial and measurable long-term impact. Prior to joining the WHO, Dr. Asma served in leadership positions at the Centers for Disease Control and Prevention for over 2 decades. And by building successful collaborations, she established several global programs focused on tobacco control, non-communicable diseases, environmental health, and injury prevention. Dr. Asma is recognized for leading the establishment of a reliable, sustained surveillance system for tobacco control in 180 countries. That's a huge scope. Using innovative technologies to monitor health outcomes and generate epidemiologic and economic evidence to drive policy level interventions. Currently, Dr. Asma and her team at the WHO are focused on strengthening country health information systems to support data tracking during the COVID-19 pandemic. By aligning with countries and partners, Dr. Asma is working to ensure every country has a robust data and health information system to track COVID-19, to make health data accessible, and most importantly, to use data to improve health outcomes. Lastly, I want to recognize Dr. Asma's scholarly contributions to science. She has contributed to more than 100 publications, books, and policy papers on global health and public health surveillance. And she is internationally recognized as a scientific and policy expert. Thus, we are very honored to have Dr. Asma with us today to talk about the role of international organizations during a global pandemic. So on behalf of all of us gathered here today, I want to extend a warm Kansas City welcome to Dr. Samira Asma.
Thank you very much. Thank you very much, Dr. Kessler. And it is truly an honor and a privilege to be a part of this important discussion. And I would like to thank the International Relations Council for inviting WHO and me to be a part of these lecture series, which is coming at a really important time. Now, more than ever before, global dialogue and international cooperation and solidarity is so critical to promote health, to keep the world safe and serve the vulnerable. Every one of us have been affected by the pandemic. So today, I would like to briefly cover the important mandate that all countries, including the United States, as the member of the World Health Organization, has entrusted the organization, its history and mandate, which has where we have taken a very deeper look into following the course of the pandemic, as well as the ways that we can improve international coordination and emergency preparedness for the future. So let me begin by saying that COVID has truly underscored the importance of timely, reliable, and actionable data, and has also highlighted significant gaps that has hampered every country's and global community's ability to respond to the pandemic and save lives. As of today, official records show more than 260 million confirmed cases and about 5.2 million reported deaths. And this is grossly an underestimation. We will soon be coming up with excess deaths, and various other modelers have already shown that the deaths will be at least 2 to 3 times higher than officially reported to WHO. Let's talk about vaccines. Of the almost 8 billion vaccine doses administered, 80% of those have gone to the G20 countries, primarily most developed countries, and low-income countries have received just 0.6%. And WHO's strategy to achieve global COVID-19 vaccination, at least by mid-2022, target is to vaccinate 40%, at least 40% of the population of every country by the end of this year, and 70% by the middle of next year. And we know we will not be able to reach these targets without very ambitious cooperative will and political commitment, as well as transfer of technology and knowledge and tools. Achieving this truly requires multi-sectoral collaboration, which is the topic of the discussion today. And I'm talking to you today during a historic moment that is unfolding here in Geneva at the World Health Organization headquarters, where all 194 countries, our member states of WHO, are meeting to provide a framework for solidarity and strengthening health security. And during this session, member states are considering one single agenda item during this World Health Assembly special session. It is about developing a WHO convention or a pandemic treaty. Our Director General, Dr. Tedros, has said, and WHO as a global steward of health data, we are committed to attaining highest possible standards of health in all settings, as is outlined in the Universal Declaration of Human Rights. And COVID-19 has truly underscored the need for multilateralism and sharing of data as a global public good to inform timely response and equitable recovery. And this is truly the focus of the World Health Assembly special session. And you see the quote that is embedded in the WHO's constitution that the forebearers had envisioned many, many years ago. So over the past 2 days, tomorrow is the conclusion of the special session. All countries here that are listed as the friends of the treaty have proposed to the Assembly to establish a negotiating framework to strengthen pandemic preparedness, which will result in a comprehensive and a coherent approach to strengthen the global health architecture and governance, which is much needed. Viruses no borders or respect no borders. And this truly requires not only ministries of health, it requires whole of government and whole of society approach to prioritize, and also to prioritize equity in health, which we have seen that the inequities have deepened, and we have seen it throughout the course of the pandemic over the last 2 years. This is not new for WHO to negotiate a treaty. You may recall that WHO negotiated under its own mandate the first treaty for tobacco control. Even tobacco marketing knew no borders. It was a communicable risk factor like the virus. So there is a precedence, and the Framework Convention on Tobacco Control was established in 2003, ratified and signed, ratified by many countries except few, including the United States, have not ratified because of its own constitution. But the treaty making process and the point in time when a treaty is ratified, it truly represents a paradigm shift in developing a regulatory strategy, which in the case of tobacco control related to an addictive substance, which we knew is a legal substance that is meant to kill. So the COVID pandemic and the COVID-19 crisis illustrates the need for a similar framework so that the international health regulations, the sharing of information, sharing of data, tools, medicines, and vaccines are available to all countries and ensure that every country is better prepared and respond to future health emergencies. Coming to the Sustainable Development Goals. We know, while SDG 3, goal number 3, relates to health, but we also know that health connects all the Sustainable Development Goals, whether it relates to climate, relates to education, poverty, gender equity and human rights, and many others. And across all the Sustainable Development Goals, there are about 59 to 60 health-related SDG indicators embedded within these goals that touches from nutrition to pollution to air quality and poverty and development. So improving health outcomes will directly or indirectly boost other targets and progress us towards the attainment of the 2030 agenda. We are less than 10 years away from the 2030 agenda. And we know we were already off track when SDGs were established in 2015, but now the pandemic has thrown us off track. Many of the very hard-won successes are getting lost or at risk of us losing those successes. So urgency is extremely important, but underlying this is the need to have reliable data systems so that we can truly be accountable and track the progress. And where we know that we are faltering and not making the progress, we take a stock and course correct and come back on track and accelerate towards the trajectory leading to achieving those targets. So what have we done as the World Health Organization, as its mission to promote health, to keep the world safe and serve the vulnerable? WHO's strategy, the 5-year strategy, which is called the WHO's General Program of Work, which is 13th in its series, under the leadership of Dr. Tedros. He really has brought in a transformative agenda, which is underpinned by robust accountability mechanism, which is called the results framework. And I'm really thrilled and excited to share with you that WHO, as an international multilateral organization, must be accountable, not only accountable in phrase, but make a measurable impact in the lives of people we serve. And if we can't count, we cannot be accountable. So the results framework is underpinning this 5-year strategy called the General Program of Work. And it is built on the Sustainable Development Goal indicators, which all countries have signed on to and are moving in that direction. So what we coined as that member states agreed to are the 3 billion targets, and this was established in 2018. The idea was that by 2023, which was the 5-year strategy, that by 2023, 7 years off to 2030, we would have at least 1 billion people having access to universal health without incurring financial hardship. At least 1 billion people protected from health emergencies, and at least 1 billion people enjoying better health due to healthier environmental policies. This is called the 3 billion targets, which stays put. We are also now considering to increase the ambition as a result of COVID to make sure that we are still having at least 1 billion people access to universal health without financial hardship. We already know we are far away from that promise where health is a human right, but the access is meager and the financial hardships that the populations face lead them to extreme poverty. So it's still an ambitious goal because we are only 230 million people today are covered with UHC, universal health coverage, without financial protection. So there's a long way to go. So we are hoping we will keep the 1 billion ambition as is, but increase the ambition for health emergencies protection to cover the entire world's population. For that, we need to improve the measurement system as well as the timeliness and accessibility of data to ensure that we are timely in responding and preventing emergencies from becoming pandemics or epidemics. And finally, the healthier population, which includes many of the healthier policy instruments, whether it is related to tobacco control, alcohol prevention and control, and malnutrition, obesity, mental health, which we have seen an rise in road safety, etc. The ambition will move from 1 billion to at least 3 billion by 2023. So that's how WHO is working with our member states, countries, and across all the multilateral organizations towards achieving these triple billion targets. We have also undertaken the first ever assessment of where countries are with regard to their data and health information systems, and that is coined in a very relevant SCORE for Health Data Technical Package. And SCORE stands for various words: S for surveys, C for civil registration and vital statistics, and so on, and you can see on the slide. But let me identify a couple of gaps that are very pertinent to the current situation we are in. Surveillance systems. Every country ought to have integrated public health and disease surveillance systems. But this assessment found that only 27% of countries have sustained capacity to survey health threats. Long way to go. Let me share another example, which is so important for every country's governance system. Every country should have good civil registration and vital statistics, counting births, deaths, which are the bookends of life, and everything in between as to what makes people sick and what people die of. What did we find out of this assessment? 4 out of 10 deaths are unregistered. When we zoom into African region, 9 out of 10 deaths are not registered. Only 30 countries have high quality cause of death notification systems. That means it leaves majority of the world not able to assess the cause of death. And this is the case and the challenge that we have experienced during this pandemic. We are struggling and scrambling to identify the true impact of the pandemic. Every country is challenged. Soon in December, in a few weeks' time, WHO, along with all the UN agency partners, United Nations Statistical Division, and all the best modelers coming from various academic institutions and other sectors, have come together to develop a methodology that all the countries have signed on to. We've collated data and making it available in public domain, which also has been a challenge. Data fragmentation abounds us. We will come up with the excess death estimates, which also has been reported by other entities, including The Economist has done a fantastic job in showing what the excess deaths might be. So we will soon be reporting on the excess deaths for the past 18 months of the pandemic. Total excess deaths by region, there are 6 regions of WHO, by all countries, for all countries, by age, as well as by sex. And this will quite be informative and will inform how we allocate limited resources to where they are needed most. So that is on excess deaths, and the lessons here is that every country should get a higher score across the score spectrum. Optimizing routine health information systems is so critical, and many countries have very fragmented systems, and we have the tools. The score technical package offers the tools, what needs to get done. And our hope is when we repeat this assessment, we hope that the countries would truly have invested and stepped up in their data and health information system capacity. So that relates to counting. What else are we doing currently is something I want to share with you. And I was just at that meeting with Thailand, who has volunteered to get involved in an arrangement called the Universal Health Periodic Review. It is modeled after the Human Rights Review mechanism. It is a member-to-member state cooperation platform where there is an assessment of countries' preparedness capacity, identifying what the gaps are, and providing those targeted technical or financial resources to close the gap. We have about 15 countries that have come forward to pilot test the Universal Health Preparedness Review, which potentially will serve as a precursor and an evidence to the pandemic treaty that I mentioned in the beginning of my talk. And we hope this process that will unfold over the next 2 months, where when we will report to our executive board in January, will truly demonstrate what do we lack in improving the preparedness capacity, whether it is health system strengthening, or it is the governance, or both, and how we can improve those in terms of having every country better prepared. We all rely on multilateral. No agency, no country, no individual can act in isolation. So WHO is engaging with many multilateral mechanisms, and many, to highlight a few. One is the SDGs Global Action Plan, which brings together 12 multilateral organizations to align resources to support, strengthen countries' ability to reach the SDGs. There are many organizations, including UNICEF, UN Population Agency, World Bank, and many others. There are many accelerators within the SDG Global Action Plan. One is on primary healthcare, how important primary healthcare systems are, data and digital accelerator, and many others on equity and many more. So the work is progressing from that front at a multilateral level. You may also have heard Dr. Tedros and many of the heads of state and heads of government engaged, whether it is the G20, G7, the BRICS, and many of the regional blocs. Now health is truly at a high political level, and that's where we would like health to be and the commitment that should flow in. And Universal Health Preparedness Review is not only focused on health ministry alone, it includes the highest level of government and multi-government institutions, including finance and interior and foreign affairs and many others. WHO, as you may have heard, launched the Academy, where the vision is to provide training to many at a single time remotely. It's based in Lyon in France. And we hope many of the academic institutions will contribute to the curriculum, to the design of the WHO Academy as we go forward. A lot of work has gone into that. We also have a health data collaborative, a partnership which brings together over 80 organizations, including academia, civil society organizations, public and private partnerships, to improve how data systems can be strengthened in countries. So here I hope I gave you a flavor of what's going on right now and what are the challenges. But the underlying message is, when we don't count, we can be accountable for the results. We all are here for a limited period of time, and COVID truly has been a clarion call for us to improve the measurements and improve multilateralism. And only then we can have an equitable response and recovery to prevent the future outbreaks from becoming epidemics and epidemics from becoming pandemics. And good health data, or good data in general, is truly the lifeblood of public health. And it must be shared as an open public good. WHO is moving towards launching the World Health Data Hub. We recognize data governance will underpin this. We need clear principles, data sharing policies. We ought to make sure that while data is open and as a public good available, we also want to make sure that the privacy of the individual is managed well and protected. That is very important. And WHO, along with partners, is moving forward to provide a playbook for every situation as to how data should be governed. So in addressing you, I truly am excited and look forward to learning from you. You are the future leaders and will be charting the path towards the 21st century, because the public health of the 20th century is truly insufficient, and we ought to truly be multilateral in our approach and in our thinking. With that, I would like to thank you, and over back to you, Dr. Kessler.
Thank you, Dr. Asma. Thank you for sharing with us this kind of broad backdrop of the WHO's efforts to really strengthen this data collection system, and really in a health equity approach by trying to raise the standard across all countries and the ability to track these important health outcomes that we know are linked to not only funding opportunities and targeted technical assistance, but the ability to better, reach the needs of people. So thank you for providing us that, not only in the context of COVID, but these long-standing goals from the WHO with social development goals and universal access to healthcare. So I think in that backdrop, I thought maybe if we could ask, a couple more questions to you. And I think related to that emphasis on data, you've really shown the importance of being able to collect and analyze this data in response to a pandemic like COVID. Could you talk a little bit about how you ensure that the collection and analysis of the data that come from the country nations are reliable, and over time, maybe what some best practices have been? I guess maybe a little comment on maybe what some pitfalls are, and from that, best practices that maybe have been developed to try to support countries in having the most reliable data shared with the WHO.
Absolutely. Thank you for the question. And I think the reliability and the comprehensiveness of any data system is going to be very crucial during the emergencies or non-emergency situations. Under the international health regulations, countries are required to report on any events of public health concern to WHO. And there are systems in place where countries report on the data to WHO, and we have to regard those as reliable from countries' perspective. At the same time, we know that many countries' underlying infrastructure is weak, as I already mentioned through the score assessment. There are many countries that don't have the systems in place, either due to lack of resources or lack of fragmentation. From WHO's perspective, we will take the responsibility. Until recently, we did not have very optimum digital systems where countries can deposit data in a very simple and easy way and easy platform. There is fragmentation everywhere. We are in a siloed world. Every disease topic has its own data system and its own database, and it is also same with other organizations, and also same in the countries. So there are many factors that inhibit the reliability, timeliness of data and the completeness of data. Many of the data that is reported, it is hard to disaggregate by gender or by any other socioeconomic categories. If we don't know, we can't close the gap. So it is a mixed bag. What we have found when we look at deaths, Europe, some of the most developed and advanced countries have good civil registration and vital statistics, which is good administrative systems in place. Civil registration and vital statistics is not the responsibility of health sector alone. We need Department of Justice, Interior, National Statistical Offices, all have to work together in the countries. And now there is an increased recognition. COVID truly has been a wake-up call. So I think from crisis comes an opportunity. And we really hope that along with the academia, which are at the forefront of identifying what questions to ask, what data should be collected, that we through the multilateral mechanisms are more aligned, more concerted, and not overburden countries, but provide the tools and sustainable mechanisms for every country to to have a reliable system of their own, not dependent on external partners or donors alone, which sometimes can be very sporadic. So that is where WHO is working towards with the Score for Health Data Technical Package, World Health Data Hub, to have a direct portal with countries, and for countries to use that digital portal from national, subnational to district health levels, where primary health care monitoring and evaluation mechanisms are not used only for reporting to donors or for at the national levels, but the data is truly used to improve the performance of care at the primary level, a primary healthcare level. So those are the ambitious, I think, plans, but we need to segment it and reduce the fragmentation and bring in those multilateral platforms so that we are working truly in a collaborative and cooperative way. There is a lot of work for everyone to do. I think collaboration rather than competition will get us to where we must get to.
Thank you. I think on a somewhat related note, we had a question in the chat that was asking if there's any method or mechanism for holding countries accountable if they don't report accurate information, or perhaps they failed to report information on key outcomes at all. Is there such a process, or it's all, just considered a voluntary option of sovereign nations?
So the international health regulation, the countries are required on the deaths. Countries have reported on the deaths. As I mentioned, it is the underlying systems as well we need to take into account. And we are working in an environment of collaboration, cooperation, and trust. The United Nations system was created for all countries to come together to solve global problems. And we are seeing that in both ways through the lens of COVID-19 pandemic. But now, as I mentioned, the Universal Health Periodic Review, which is a volunteer mechanism at the moment for member state to member state dialogue, to share information, to share tools, and to share technology. And as we go forward through the negotiations of the Treaty for Pandemic Preparedness, we hope there will be some binding instruments where countries are required to submit data and there is benchmarking towards that end. But I think it is very important to see this as a cooperation and solution rather than as pointing fingers, because we are all in this together. And I think, and I believe that there is a trusting environment, what I have seen just coming out of the World Health Assembly special session. We see all member states towards a single common goal, recognizing the need for an instrument for pandemic preparedness.
Okay, thank you. Also wanted to ask, certainly the WHO has been involved in previous epidemics or pandemics. I certainly think of the leadership role with HIV. Could you comment a little bit? How has WHO's response to COVID-19 been distinctly different? Has it been distinctly different in any ways as the role WHO has taken in the past?
I think the world was caught by surprise with the COVID-19 pandemic. And the emergency program is working 24/7 around the clock, along with our 6 regional offices and the country offices with the WHO country representatives providing the support to the countries. WHO is a normative organization coming up with timely guidelines. The International Classification of Diseases, immediately categorizing and defining COVID-19 pandemic and how countries should be using that definition in the diagnosis. And you have seen many guidelines coming forward and having the networks of the networks, whether it is identifying the variants or whether it is the solidarity trial, whether it is developing the ACT accelerator or the COVAX, which is the vaccine collaboration between WHO, Gavi, UNICEF, and CEPI, all coming together for vaccine distribution. Understanding and collaborating on at the international regulations and trade regulations, working with the World Trade Organization, and moving towards waiver for the TRIPS to make the vaccine and technology transfer and creating the transfer hubs for other countries also to manufacture. So I think we could do more, we could do better, we could do faster, we all must. So this truly has been a wake-up call. And I think under the leadership of the Director General and many of the other leaders in the countries, in the civil society organization, academic sectors, I think the partnership has truly been phenomenal here, and hope this will continue. And we come to a point that we should be able to predict and prevent from this to happen again, which we know is going to be inevitable. It will, but I think the question will be how prepared we will be next time.
Mm-hmm. Thank you. I wanted to ask you a little bit about vaccine hesitancy. It's certainly something in the United States we're experiencing and in our state of Kansas as well. But if you could comment a little bit about sort of the evolution of vaccine hesitancy or the prevalence that you're kind of experiencing on a global scale, and maybe a little bit about what WHO is doing to try to address that.
Sure, there has been a infodemic, as you may have heard, that was coined at the beginning of the COVID pandemic, and we have seen how information has traveled and communicated so quickly and so rapidly. I was talking to the delegation from Thailand that is doing regular surveys and monitoring the vaccine hesitancy, and also relating it to the governance mechanisms and the response and the communication to the population. I think the policymakers need to remember during any crisis to be the first to communicate the truth, what we know, what we don't know, and also to listen to the public as to what are the reasons for the hesitancy. And there are many factors, and we have seen this unfold in many countries, including the United States and in many other countries. And it is going to be work in progress. WHO has also worked with many of the tech companies, including Facebook and Twitter and many others, who voluntarily moved forward in taking out information that was not accurate, that was not scientific or evidence-based. So I think we are living in an age of instant communication, and it is hard to control, but we ought to really have that relationship within a country and the governance system, and the trust is also related to vaccine hesitancy, but that has been demonstrated in a number of countries through number of studies. So a work in progress.
Okay, thank you. We have another question from the audience. What do you see as the role of university academic health centers to support or help partner with the work of the WHO?
Beautiful question. WHO, as Dr. Tedros says, we embrace partnerships. There is a huge number of collaborating centers in thousands that collaborate with WHO and has the affiliation called the WHO Collaborating Center. That means the academic institution is an extended arm of WHO. Prior to joining WHO, I was at the US Centers for Disease Control for 23 years. And CDC has a number of collaborating centers, infectious diseases, communicable diseases, on tobacco, on road safety, collaborating center. It is a means to share the cutting edge research, information, resources with WHO that can be made available at scale rapidly to everyone. There are networks of collaborating centers on particular topics, whether it is mental health, you mentioned HIV, AIDS, or malaria, and many are coming from the United States. We have lesser collaborating centers in least developed countries, and our focus is now to looking at centers for excellence there and trying to bring those as the collaborating centers. So what can be done is what the universities are good at, research, cutting edge knowledge that can be shared. And I mentioned about WHO Academy is another means for the academic institutions to connect and share what you are teaching or what you are sharing with the world. So there are now many more possibilities, and we welcome working with the academic institutions, as always we have done.
Excellent. Thank you. I want to take another question that just popped up in our chat here. Has the US fully re-engaged in supporting the WHO financially? And have other industrialized countries continued their proportional support during this period of COVID? Have we seen the US fully re-engage, and sort of what has that response been during COVID?
We are very grateful that United States is fully re-engaged. As you have heard from the current administration, President Biden sent a letter and a delegation to engage with WHO and reinstate its position. And now, even with the discussions over the past 2 days, Colin McIff, who is the delegate from United States government at the World Health Assembly special session, co-chairing the session this past 2 days, has been fully engaged. And yes, what WHO is looking for is contributions from member states. That's how WHO functions. And what we are saying is not topic-specific contributions, because a member state might be interested in a particular topic and funds only that topic, or allows only those funds to be allocated to that particular topic. But to make the contributions in a way that once we agree with the member states on the strategic direction and on the priorities collectively, that the contributions that are assessed from the member states are directed to those priorities that we have collectively agreed upon. There are more resources that are needed, but we have seen a huge overwhelming support from a number of countries, including the United States, And more is needed because we have a significant shortfall. We are already seeing a significant shortfall, even with vaccine supply, where we are seeing immense inequities, and we need to move on that very swiftly.
Thank you. Okay, so this question, over this last super intense year-plus period of, living and breathing the COVID response, as you reflect in your role in WHO, what would you say are, one or two key lessons learned thus far?
A sobering question indeed. And I think this has been a truly preventable tragedy that is unfolding in front of our eyes. I just want to leave one story that perhaps would answer the question. It was in the beginning of the pandemic, and it was an article from a British newspaper. It was a visual of 6 newborn babies wrapped in a green cloth lying side by side. And this was from Zimbabwe. And the reason for these newborn deaths were because there was not adequate access to healthcare workers in a hospital. So this is the indirect effect of COVID that we are seeing. And these are all preventable deaths that we are seeing because of weak health systems, because health has not been a priority in a number of countries or even globally. And now is the time for us to take health seriously. As Dr. Tedros says, public health is not a cost. It is an investment, and it is indeed a human rights issue, and we ought to really move in that direction. And health for all should not be a panacea. We should not at least leave within our lifetime still say health for all or universal health coverage and still see that there are so many unmet needs. It shouldn't be that case. Health is indeed a human right, and it should be available to all.
Thank you. We have another question, just a slide step to the right though, but related from our audience, wanting to kind of hear some thoughts on what priority is the WHO placing on addressing mental health globally? And is that sort of rising to one of the top concerns, or any comments there would be welcomed?
I think COVID again has really underscored the importance of mental health. Under the Sustainable Development Goal 3, there is an SDG indicator on suicide. And it is one of the indicators in the Healthier Population Billion. And when we really study suicide and trace it back to even mild depression, there are so many actions we ought to take. And this is an area that has not been adequately studied, funded, or made known. There is still a lot of stigma, perhaps not in most developed countries, but still in many of the developing countries. It's associated with, it's a silent epidemic that we are seeing. What WHO is doing is using some of the innovations that we have seen. One is called the Friendship Bench, that has been used in some of the African countries very successfully during the course of the pandemic, where the grandmother comes in or a healthcare community worker. It's a bench, it's counseling, it's talking, telemedicine, telehealth. I just spoke to Thailand, again, that has been at the forefront of public health. They were the first ones to have the quit line for smoking cessation on the cigarette packs. They just said, now they have expanded those quit lines for mental health. These are the successes that we should just collate and scale up. We are also proposing, at the request of countries, to introduce a special indicator on mental health. The current universal health coverage index within the SDGs, which is health SDG number 3.8.1 is universal health coverage. That index on service coverage does not include mental health. It should be a part of mental health. So what WHO is doing is proposing to the UN body that deals and is responsible for the Sustainable Development Goals and its entire measurement system to rehaul the index for universal health coverage to not only include mental health, but also as simple as cataract surgery should be a part of universal health coverage. And many other areas that we take for granted, pay out of pocket when they should not be and should be a part of primary health care. And training of the healthcare workers is also important. And the mental health of healthcare workers is also extremely important. That has not been studied adequately. So that area is extremely important for us. And if you have any suggestions, we look forward to hearing from you.
Well, thank you so much, Dr. Asma. That is encouraging, as we know COVID has shown a spotlight on the unmet need for addressing mental health in our country and globally. So that's encouraging. I know we want to thank you so much. This has been so nice and enjoyable. And I want to turn it, our time unfortunately is up. I want to turn this over back to Matthew Hughes.
Thank you so much, Dr. Kessler. Pleasure to meet you virtually and to meet everyone virtually. Thank you very much.
Dr. Asma with the World Health Organization and Dr. Sarah Kessler with KU Medical Center, we are so appreciative of your time and insight today. This is an evolving situation, obviously, and Dr. Asma, I was reflecting on the outbreak of the pandemic and the first days of the pandemic, and how many of us in the U.S. thought that this would be over in a matter of weeks and that we would be resuming normal life. And we are just so grateful to you and your colleagues, medical professionals around the world, for the hard work that they are doing, that you are doing, in helping us all get through this time together. So thank you so much for taking time out of your incredibly busy schedule to be with us today. And thank you to all of our audience members, both those who are joining us live as well as those who will view this recorded program later on. This brings our Great Decisions lecture series to a close, and we'd like to thank again our series sponsor, Cyprian Simkowitz and Jerry White, as well as Nancy C. Messer. We'd also like to thank KU Medical Center for their support of today's program. We look forward to continuing the conversation with all of you in the weeks ahead on themes around global health, as well as other international realities and challenges. And visit us online at irckc.org. Dr. Asma, Dr. Kessler, thank you again to both of you, and we'll see you all very soon. Take care.
Thank you, Matthew.